Welcome back. Well, attention deficit hyperactivity disorder, or ADHD, is often associated with behavioral issues. So the question is why, and how can parents help their children with ADHD avoid some of these issues that can be frustrating for everyone? Dr. Robert Reynolds of the Reynolds Clinic is here to talk about ways to do that. Welcome, Dr. Reynolds.
Thank you, Karen.
Let me ask you first, when you hear ADHD, a lot of times we know, oh, that means a behavioral disorder. Why?
Well, that's the key in understanding why children who have ADHD have behavior problems. One of the easiest ways to explain it to parents who are really frustrated and confused by all of the symptoms is a concept that I call the attentional threshold. Now, the attentional threshold is something that we all have. That something approaches us at our attentional threshold, we find it interesting. If it's below our attentional threshold, we find it boring. So, as you can see from the model, children who don't have ADHD have an attentional threshold that's set relatively low, so that they can pay attention to things above it. Children, on the other hand, who have ADHD have attentional thresholds that are set very high. So things have to be above that attentional threshold, and they're fine.
In layman's terms, they need a lot of stimulation to pay attention. It's got to be really engaging or interesting.
Yes, it does. And unfortunately, most classrooms are way below their attentional threshold.
Okay.
And so the challenge becomes, what does a child who has this high need for stimulation do when they're locked in an environment that they cannot escape from, a classroom, that's low as far as the attentional issues are concerned.
Okay. And so often what happens is that's when you're going to see these three, there's probably more, but there's three behavioral options that often this child will do when they're really bored.
That's true, and unfortunately we have a way of labeling children in a very negative way as a result. One child will just stop paying attention, he'll fidget, and he'll just be distractible. But what he's really doing is he's not paying attention to what the teacher wants him to pay attention to, he's paying attention to something else. But we label this child as inattentive. Another child will squirm and get out of his seat and go sharpen his pencil and want to go to the bathroom. All as a way to stimulate himself physically so he can get things up above his attentional threshold where he can pay better attention.
Okay, so his brain's telling him what he needs.
But we call these children hyperactive. We label them as hyperactive.
And then they can be disobedient.
Worst case scenario, high threshold kid in a low threshold environment, he'll act out and be disobedient. Why? Because he's wanting to bring everybody up to his attentional threshold where it may be negative attention, but he's feeling engaged. And so, unfortunately, he gets punished. So
I know one of the things you do is you actually go to schools and you talk about teaching teachers how they can, if they can teach to the kid who has the high threshold, they can teach to everybody. So that's one solution.
Well, that's an excellent solution for teachers who are open to that. You know, oftentimes what we try to do with these children is we try to get them to fit into our classroom environment, whereas if we can adjust the classroom environment to engage them, every other student benefits.
But if that's not a realistic, maybe that's a long-term solution as more and more schools are looking at different ways. But the other solutions that some of them don't work, like you're saying punishment, which is, as a parent, that's what you think. Time out, you're being bad.
Yes.
You say it often doesn't work.
It doesn't because, again, they're impulsive. They're not doing these behaviors, generally speaking, on purpose. They're trying, in a sense, to compensate for their condition. So think about it. We're punishing them for their attempt to compensate for their condition.
Counseling.
So punishment doesn't work because it may work for the moment, but it doesn't have lasting effect, because if it did, you wouldn't have to keep punishing these children over and over again.
Right, okay.
Counseling. This is a big one for me, Kara. Unfortunately, I see so many children with ADHD and these kind of behavioral problems in counseling, and these children just don't do well in that environment. They don't like talking to strangers about their feelings. They'll go if their parents make them, but unfortunately, I hate to say this, but many of my colleagues don't know how to work with these children either, so they end up playing checkers or board games in an attempt to establish some rapport with your child, but the therapy goes on for year after year, and there's no significant change.
Medications, that's also sometimes a first line of defense from doctors.
Well, unfortunately, it's often the only thing a parent is informed about, and what I say about medications is that I'm not against them, but it ought to be the treatment of last resort, not the first thing we turn to, and also it's not a long-term solution. Now, I want to say one more thing, Kara. If you decide to go along with your doctor's recommendation to medicate your child, at the very least, you should ask your doctor, okay, doctor, I'm willing to do this because I trust you, but what's the exit strategy? In other words, Are you saying that my child needs to be on this medicine until he's 80 years old?
Right. So before we run out of time, you do something called neurofeedback. That's what happens at the Reynolds Clinic, as well as parental solutions. And you say those solutions are more permanent because it gives your kids skills instead of pills.
Exactly right.
All right. So we have, if you want to learn more about that part, and there's a whole wealth of information that you like to educate parents, you have a free seminar coming up. Maybe it's an alternative for you if you're considering this. It's a seminar on ADHD on April 6th is one of them. The other one, April 13th, at different times, so you can accommodate all different schedules. So head to the website, reynoldsclinic.com, and you can sign up there. I know one is on the weekend and one is during the week, depending on when you want to go.
Yes.
All right. And the office, again, right in Middletown.
Very close by.
All right. Thank you so much, Dr. Reynolds. Scott?
All right. Thanks, Karen.